Hello and welcome back to the Patient First Podcast. I'm your host, Dr. Bryan Laskin. And as always, I'm very excited that you're here. And we are here at the Chicago Midwinter Meeting with the amazing Aimee Vail. Thank you for being on the podcast.
Oh, thank you so much for having me. I really am so happy to be here at the Toothapps booth on the Chicago Midwinter floor. It's very busy here.
It is busy. Yeah, there's lots of people looking at all sorts of stuff. We have a bottle of tequila that attracts a lot of people. It's fun.
And Apple AirPods too. You guys got a good booth going on here.
But we also have stuff that you brought,
I
right?
did bring stuff to your booth to showcase and tell you all about the minimally invasive dentistry, that we have this movement into the dental space. That it has been a movement, and there are some of us that really promote it. And we were just at Yankee a couple weeks ago. And that was all of the experts in the room and those that want to be part of this movement a little bit more in minimally invasive. We had the Oral Health Prevention Summit. Jessica Woods and Melissa Turner had put that on.
Yeah, great event.
Fantastic. You were on a panel. That was great. You did the AI panel, right?
Yep. Good nerd stuff.
So I love talking nerd stuff. I do. I love it. Who was I with? Oh, I was working with somebody today, and we went past the scientific posters, right? And we both were like, oh, we like to look at those scientific posters, right? Not a lot of people do, but, kind of nerd out like that with the minimally invasive dentistry as well.
Yeah.
And then not only with those procedures, talking about them, teaching about them, very exciting. Next month, do you know who Crystal Spring is? She was at the
Montana Smiles.
Oh yes, yep. Smiles Across Montana. Brilliant woman. She has the heart the size of the world, right?
Yep, absolutely.
And she has an opportunity for a free clinic. Okay. It's in partnership with Montana State University.
Okay.
And it's also in conjunction with their annual powwow, because they have a very diverse Indian population there in Montana. I'm going to be going out there, working with all of the products in minimally invasive dentistry.
Wow.
Okay. And including, which I'll talk about in a minute, our wonderful Silver Sense SDF from Centrix that is changing so many lives now.
So let's unpack a little bit of what you said, because I think we talked a little bit before, 40% of dentists don't have an intraoral scanner, right? And I think a lot of us who I had my first intraoral scanner I bought literally 25 years ago. They've been around for 40 years, actually more than 40 years, but there's still an adoption rate that kind of shocks me. And the same thing is true, I would guess, with minimally invasive dentistry. And I'm not asking you to bring statistics, but maybe unpack a little bit for people that might not be as familiar with minimally invasive dentistry, the things that you talked about, the Curodont versus SDF, and your SDF and how it's leveraged.
Okay, so yeah, that's a great question with when you brought up the Curodont product and also the SDF product. So, and then sometimes there was one time when I was teaching, somebody had said to me that Curodont was the clear SDF. And that cannot be any farther from the truth. But that's okay. We just need some education, because we have been doing dentistry wonderfully for years, and then coming into minimally invasive dentistry. You're right. It's what is that? How do we adopt it?
Yep.
Okay. And so the Curodont is not the clear SDF. Curodont is a regenerative peptide. So you apply it, and the lesion cannot be cavitated. It cannot be cavitated. Okay. So it has to be a non-cavitated lesion, enamel only. It is regenerative peptide amino acid. Okay. It's totally different from the silver and the ammonia and the water and the fluoride that's in there that forms a silver precipitate and completely arrests the decay on the dentin, right? We talk about the dentin or within the enamel, but it has to be cavitated. So that's what we do. So that is the difference between the two. I will be going out and using both of those products as well as iodine. Okay. There's another company that has the unit dose iodine, and that is fantastic to reduce the amount of bacteria and pathogens in your mouth. And so you can use it once a month and to reduce those pathogens in your mouth. It's broad spectrum, right? Antiseptic. We use it on our skin. It is completely safe in the mouth.
Yes.
Right? And so that helps. Minimally invasive, reducing the bacteria, not cutting, right? Not drilling, filling. We now heal teeth, right? And so this heals teeth. Curodont heals teeth. So you see that, and then something like the iodine, which would help reduce the amount of bacteria and heal teeth.
Yeah.
The same kind of concept. So that is just so important to me, to patients. I have not met a patient yet. Tell me if you have,
Okay.
that likes a drill and a needle. Have
Well,
you met anybody yet like that?
If I have, I would be scared of them, right? Yeah, or I wouldn't trust them, right? I just want to recap what you said, that when you look at iodine, Curodont, SilverSense, STF, these are 3 separate modalities to be minimally invasive. One is reducing pathogens with iodine. One is remineralizing or regenerating
Yep. Enamel.
enamel. Yep. And then silver iodine, SilverSense, arrests caries. Right?
Correct.
And all are very important, different functionalities.
Right.
And so I think that's crucially important for those who are to understand the difference and how each can be leveraged. Right now I'm very focused on preventative care and some other aspects of broader medicine. And if you think about type 2 diabetes, right? I think it's around $3 billion, maybe $4 billion at this point, gets spent on diabetes treatments, when the real way to help treat this is to prevent it in the first place, right?
Correct.
Diet and exercise,
Sure.
and now GLP-1 drugs, which is preventative, but more of a drug way to prevent it. And this is, I would say, the dental equivalent of that. Would you agree?
I think so. I think that's a really good analogy. Yeah, prevention. I was just talking to somebody on the floor yesterday about her mom, and she had no idea the biodirectional relationship between her mother's diabetes and keeping her mouth healthy.
Oh,
So, but again, prevention that's more my style. Prevention with diet and exercise. And I don't know if you know this, but I had type 2 diabetes.
no, I didn't know that.
Yeah, so I had type 2 diabetes. They diagnosed me about 4 years ago. And so now I'm in remission because
Oh, wow.
I was able to reverse it with diet and exercise there. So that's just a little thing about me.
That's good.
Right.
That would probably be something like Curodont that's reversing that. Now, something like SDF would be more of an intervention to arrest the caries, where, boy,
medically managing the caries at that point. So we're doing that, and I love it. So let's talk about the staining.
Yes,
of the SDF. Okay, so when people will come up and say SDF turns the tooth black, no, it doesn't. It really doesn't. And I have people that say, honestly, Bryan, if we're being honest here in the dental world, I can't use that in practice because my patients don't want their teeth black. Have you asked them? Let's ask them. Let's get the consent form. Let's tell them exactly what we're doing. We're now healing, putting an antibiotic on the teeth, arresting the decay, getting your mouth healthier. And yes, there's going to be stain on the lesion.
Yes.
The lesion is going to be stained, not the entire tooth. And this is an awareness. This is a campaign, okay? This is not Aimee's campaign, Bryan's campaign. This is like a campaign that we have. Those of us that were sitting in the Oral Prevention Summit, right?
Yes.
We are part of that campaign. We are trying to move the minimally invasive movement like this because this is the way that, is going to be helping our patients better.
Let's be real here,
yeah.
Right? You're not going to be, for a patient that comes in every 6 months to get their teeth cleaned, that doesn't have caries,
right.
You're not going to be doing SDF. This is for somebody who has rampant caries, where you don't even know how, not just rampant caries, but people that have active caries that maybe you're looking to arrest the caries, or maybe while you're doing treatment planning, you want, for whatever, many different reasons.
Multiple treatment visits. You can apply the SDF on there, but there's so many uses, like even with the prevention, because there's 2 codes for it, the one for the arresting and the one for the preventing of the caries, right? So you can put that, if you see a dark spot like on your 3rd molars, or under a sealant, you can put the SDF and then put a sealant over that as well. Yeah.
I'm learning stuff on the podcast. It's fantastic.
I love it. Yeah.
And I think it's great. So what else can you tell me about the SilverSense SDF and how people should leverage it, and
So really just start talking to your patients about it. Yes, it turns the lesion black.
Yes.
Okay, we know that. But if you explain to them that now we're taking care of the cariogenic bacteria, because drilling and filling is not doing anything for that, right? We're not
Correct.
changing the oral biome. We're not doing that. We need to apply the SDF, get rid of the cariogenic bacteria, reduce it with the iodine. There's so many more ways that we can do it that we know about to prevent and take care of our teeth, right? And so that's what it is. Start talking about it. Build the consent form. We can do this. Believe in it. We need to, belief, because, and it is, we have to change it. We've been drilling and filling in a way, and which is wonderful because so many people are helped, but we have this other way now too that we should be using. Reach out, ask questions. There's so much research out there now that I'm not sure why it's not in everybody's toolkit. The hygienists can place this, right? And this is just to help you making our patients healthier and more comfortable too. The reason, and then the other, I'm going to reference this again. So as I was talking to, she's a partner of ours, as I was talking to her about her mom and teaching her how her mom needs to keep her teeth clean, really clean with the diabetes, she also shared with me that she hasn't been to the dentist in 5 years. And I know I'm moving away from SDF, but this is real life.
For sure.
And so then there's the vendor partner, and she haven't been to the dentist in 5 years. And then the other vendor, because I haven't either. And I'm like, well, why? Okay, you haven't been to the dentist. Nobody's shaming, no judgment or anything, but why? You know why? I already knew why. Because of the dental trauma that they experienced, because this is how I was when I was, my mother's, I can't believe you're in dentistry, Aimee, because you used to run screaming out of the chair.
Oh.
I was one of those kids. And I knew when she said, I haven't been to the dentist in 5 years because of the trauma, and he did too, because he had a root canal.
Yeah.
What if we didn't, I don't know, like I'm just saying, but I've seen enough patients and I practice now, even though I'm in corporate, and to make sure, because I love dentistry.
Yeah.
And I knew it was a trauma, and that's why they weren't coming back. But imagine if we had caught that cavity, put some SDF on, maybe, I don't know, but I do see things that, maybe a watch. Our motto here with SDF is there's no more watch and wait.
Yes.
Let's put it on there. Let's heal the teeth, because sometimes when we watch and wait, we find that 9-year-old that now has a blown out 6-year molar because we watched it in January.
Totally agree. And I can tell you from experience, having treated many patients with SDF, I do ask patients, and I've never had one say, I'm worried about my carious lesion being black. Right? They want the caries to stop.
They do.
Right?
They do.
Yeah.
It's a lot to do, I think. So it's really the comfortable. As clinicians, we often don't want to sell to our patients, right? We don't want to do that. And sometimes it feels like that. If it's a new kind of process saying that maybe, because we think of, oh gosh, it is turning black, right? And we care about our patient, and maybe they think it, but we shouldn't. Just like asking for fluoride, the fluoride movement, when we did this, come on, hygienists, ask your adults for fluoride, okay? We need to ask, and we need to present the non-restorative treatment as well as the restorative treatment. That's what we should start doing, that in the office. Here is, and let them make their decision. It's not offer it. Here's the here's the way that we could do it this way. Here's the minimally invasive way that we can do it. And if we have 2 ways, and let the patient decide that way.
It's all about transparency and giving patients their options and education. And that's
education.
That's what it's all about.
Love education. Speaking of that, I'm going to be speaking at a course at RDH Under One Roof this year.
Oh, great.
Yeah, RDH Under One Roof is July 18th through the 20th. It is our biggest conference in America for us wonderful hygienists, and so excited for that. And my co-presenter is the fantastic Sonia Dunbar.
Oh, she's great.
Oh, phenomenal. She's a PhD candidate now.
Oh, wow, cool.
I know, fantastic.
That makes one of us. Yes.
And I just think she's so phenomenal. She was at the Oral Health Prevention Summit. Did you see she just won the presidential award?
I did see that. Great.
I am so honored to be co-presenting with her on minimally invasive. And this is what we're going to talk about. We're going to talk about Curodont. We're going to talk about iodine. We're going to talk about SDF.
Yes.
We're going to talk about fluoride. We're going to talk about the arginine.
Yes.
That's doing all these things that don't require a needle and a drip.
Well, that's great.
Isn't that great?
It's fantastic.
I love that.
That's great. I love your passion about it. Where can people go to find out more information if they want to learn more, or obviously go to the RDH under one roof and see your...
Yes, please. I don't have our booth number yet, but if you reach out to me, Aimee Vail, I can be reached on LinkedIn. I'm usually at a lot of the conferences. A lot of people know me.
Yes.
Yeah, they do.
You're a big deal.
I know.
Yes.
So are you.
Well, I don't know about that.
We're a big deal recording a podcast in the Chicago Midwinter floor. Right?
Yeah, that's right. Well, we'll put a link to your LinkedIn around this around
LinkedIn,
the podcast.
And then also Centrix Dental, centrixdental.com. You can find all our products. We focus a lot on hygiene, and this is our dragon mascot. I'd like to give this to you.
Oh, well, thank you
For having me on the podcast today. So this is, and we can wrap up, I want to tell you this story about our fluoride. So we just came out with, see that? I hope they don't see that. I'm going to stop. All right, you can edit it. We just came out with our new Dragonberry Fluoridose. So Dragonberry is very special to us. It's our 6th flavor.
Okay.
All right. And so this is named after our founder, Dr. William Dragon. Sadly, Dr. Dragon just passed earlier, the beginning of this year.
Okay.
And he was 91 years old. He lived a fantastic life. He was my favorite dentist.
Oh.
Still is. Yeah, you're my second favorite.
Thanks.
Okay, no problem.
As long as I'm in the top tier, I'm good. No, I'm just kidding.
So as you can see, we named our dragon, it's Dragonberry Fluoridose.
Oh, that's great.
And now we have our mascot. And we actually, I wish I could have gotten our dragon over here for the podcast.
Oh, yeah.
We have a big dragon, and she's so hot in it. But oh gosh, it's wonderful.
Oh, that's fun.
It is. So we have that. Got a couple of candies. Got our little Weebles too. So you can check us out at centrixdental.com. All of our things. Reach out to me, and we'll get you started on that minimally invasive dentistry.
Great. Thank you, Aimee, for being on the podcast. Appreciate it.
I love that. That's great.